Today we're going to talk about pressure ulcers. So what is a pressure ulcer? They're also known as pressure injuries. A pressure injury occurs due to localized damage of the skin and underlying soft tissue, usually over a bony provenance. They usually occur when there's prolonged pressure on the area. It can look like an open wound, but it can also look like intact skin, unbroken, and it may be painful. The impact of pressure or shear, which is if you were to pull a patient, for instance, pulling them up in the bed, creates a shear. It can be influenced by nutritional factors, perfusion status, comorbid conditions such as heart failure, and the condition of the soft tissue. The preventative practices include eliminating or deterring development of the pressure injuries, and that can be done by using support surfaces and frequent turning and repositioning. What is a common cause for developing a pressure injury? Some of these causes include skin characteristics. Are they moist? Are they dry? Is it intact? What's the quality of the skin? Is it super fragile? If there is a previous history of a pressure injury, they are more likely to develop another pressure injury in the same area because the quality of that tissue isn't quite the same even though it's healed. Compromised perfusion, circulation, or oxygenation. That can also increase the risk of having a pressure ulcer. That includes diabetes or anything else that impairs the blood flow, such as peripheral vascular disease. Body temperature. Age. If somebody is advanced in years, their skin is not quite like it used to be, they've lost some fat layer under the skin, and there's not enough padding. If a patient has something like neuropathy or impaired sensation, they're not going to be able to tell, oh, that hurts, I've been sitting there too long, or particularly with the feet, if they're wearing a pair of shoes, they may not be able to feel the friction that's happening in their shoe, and you can get an area right there. General physical, mental health, if they're not able to move as well or they're depressed, maybe they just don't want to get out of bed. Also surgical related conditions or status that may impact healing and mobility. So if somebody had, say, heart surgery and they're not allowed to rotate or turn, that can cause a pressure injury. There should be a thorough medical history obtained about your patient. So critically ill patients, a spinal cord injury, people on palliative care, people who are obese, people who are getting rehab, people who are young, super young, like neonates, or elderly, they are more likely to develop pressure injuries. So take special precautions with these types of patients to prevent a pressure injury from occurring.